Study designs in pharmacoepidemiology. Today we will talk about cross-sectional study design. Learning objectives. Understand the basic principles of cross-sectional study. What is cross-sectional study? It's a type of observational study where the investigator has no control over the exposure of interest. For example, we want to assess the relationship between diet and breast cancer. The diet is already part of the daily life of any patient. So we are not doing an intervention by giving certain diet. It's already a variable that's present. It involves identifying a defined population at particular point in time, measuring a range of variables on individual basis. This includes past and current, for example, dietary intake. At the same time, we measure the outcome of interest, obesity, for example. So as you can see, the measurement of exposure of interest and the outcome of interest is carried out at the same time. So we're measuring, for example, the relationship between obesity and hypertension. Obesity is the exposure, hypertension is the outcome. We take measurements at the same time. There is no inbuilt directionality, as both exposure and outcome are present in the study subject for quite some time. So we don't know which occurred first. Is it the exposure or the outcomes? ما بنعرف إذا الأوبيسيتي صارت عند المرضى قبل الهايبرتنشن أو الهايبرتنشن صار قبل الأوبيسيتي. فما في direction في هاي relationship. At a single time point, we assess exposure and outcome at the same time. Study only exists at this point in time. Features. Cross-sectional studies collect information related to a single specified time, point in the time, but often extended to include historical information, which leads to demonstration of statistical association with past experience. For example, investigation of an epidemic. So let's take this example. We have an epidemic of swine flu, and we need to understand what are the predictors that led to this infection. So we take information related to the current and past history of the patients. However, we have one major problem with cross-sectional studies, which is temporal association. Does this design achieve temporal relationship? We will see this in future slides now. As you can see, this slide show the study design of a cross-sectional study. So we assess the exposure and outcome at the same point. We don't know which occurred first, which came first. You know the theory of chicken and eggs? It's applied here. We don't know which came first, the chicken or the eggs. The same is here. So is the exposure occurred before the outcome or the outcome occurred before the exposure? This is one major threat to causality. So in cross-sectional study, we can't obtain a causal relationship. Causal relationship means that there is an exposure that causes a specific outcome. In cross-sectional studies, we obtain an association. So we have association between obesity and hypertension, obesity and diet, but no causal relationship. خليني أعطيكم مثال تاني. نحكي إنه بدنا نعمل دراسة نشوف العلاقة بين الأوبيسيتي السمنة وعدد ساعات مشاهدة التلفاز عند الأطفال. هلأ إذا لقينا إنه في علاقة بدنا نسأل حالنا السؤال: مين اللي صار بالأول وشو السبب؟ هل السمنة خلت الأطفال ما يقدروا يتحركوا ويقعدوا على التلفزيون لفترة أطول؟ أو إنه الأطفال اللي كانوا يقعدوا على التلفزيون لفترة أطول ما كانوا يتحركوا صار عندهم سمنة؟ هذا المثال بيوضح لنا إنه المشكلة في الكروس-سكشنال ستاديز اللي هو إنه ما في علاقة زمنية. هلا عشان نحكي إنه في عنا علاقة سببية causal relationship لازم الإكسبوجر يكون صار قبل الأوتكم. فهاي المشكلة إنه إحنا بنعمل الدراسة بطريقة إنه كل الميجرمنتس بتصير at the same time point، ما بنقدر إنه نحقق هذا الشرط. Other synonyms for cross-sectional studies include prevalence studies, simultaneous studies, instantaneous study. Prevalence study because it's the same way that we measure the prevalence. Prevalence is measured through cross-sectional studies design. When we can use such design in community healthcare, we can use it for health community diagnosis, for health status, determinants of health and disease, association between variables, identification of a group requiring special care. We can use this design for surveillance studies, as we said, in the epidemic infections, in community education and community involvement, in the evaluation of community healthcare.